Okay, I'm Nick Gora from Neuro. I'd like to welcome Dr. Richard Boles to our podcast, Omega Needs, How It Works and Why It Stands Out. And without further ado, we're going to jump right into the discussion. So, Dr. Boles, first, why don't you tell us a little bit about your background and where you practice?
Well, I'm a pediatrician. Then I went back to residency to become a medical geneticist. I was at Children's Hospital Los Angeles and faculty at University of Southern California for 20 years. And I did a lot of metabolic disorders in which I learned to use nutrition to help people with disorders. And during that, I learned how important nutrition was, and particularly dietary supplements and mitochondrial supplements in the treatment of autism, ADHD, and many other conditions. Then I went into biotech to learn how to work with genetic sequencing, DNA sequencing, and now I'm in private practice. I see patients by Zoom, but I also am a partner with you and Chris Manthaus in Neuro Needs to make dietary supplements to help these disorders.
So, why don't you tell us a little bit about omega 3s and why they're important for brain health and what role they play in our brain's functioning?
Well, the dry weight of the brain is more than half of it is lipid or fat. The brain is very fatty, and about 30%, 35% of that lipid are omega 3 fatty acids. Now, omega 3 fatty acids, we can't make them. Animals and plants can't make them either. Only microorganisms can make omega 3s. So it starts at the microorganisms and then it works up the food chain. Where in the ocean, it's in the plankton and then it works its way through the fishes and for the crustaceans like shrimp, and then it finally gets to our plate. And on land, it's in the dirt, it's in the mold, it's in the mildew, the microorganisms that work its way up. But with factory farming, that doesn't happen anymore. And the corn that the cattle are eating or our vegetables are all washed of all of the microorganisms, and we don't get omega 3s in our diet. So unless you're eating a lot of naturally caught seafood, you're going to be deficient in omega 3s. And this is a problem throughout the world. If you are eating a lot of seafood, not farmed, that still doesn't have it, but naturally caught, you're probably going to have mercury poisoning as well as other issues. So most physicians that care about nutrition, what they've been doing is they have been, sorry, that they have been using omega-3s by supplementation that they are recommending, mostly fish oil, for their patients, particularly their older patients that have multiple health problems, as well as patients of all ages to try to prevent dietary deficiencies and to try to mitigate what might happen and to improve overall health.
Now, what about individuals with autism, ADD, severe ADD, ADHD, and other neurological disorders? Do they have even a greater need for omega 3s?
Well, because the omega-3s make up such a large part of the brain, they do. Omega-3s have been used for a long time in autism and in ADHD, and there's been many different studies on that that have shown that they help. They increase attention, cognition, that's thinking, and emotional control. They decrease impulsivity, hyperactivity, and defiance. They've also been shown in general, not just in people with brain disorders, but to help cognitive functioning, to help you think clearer and faster, as well as to help focus in general.
Okay. So, why don't you give us a little bit of background into your design criteria for omega needs?
Well, the problem with fish oil is that it doesn't cross the blood-brain barrier. Fish oil is bound, the omega-3 fatty acids are bound to triglycerides, and that does not cross the blood-brain barrier. It needs to be converted to a phospholipid form by the liver, which then can go into the brain. The problem is that high-dose fish oil is great for the heart and much of the rest of the body, but the liver's conversion is very limited. And so giving a very large amount of fish oil really only gives a small amount of omega-3s to the brain. Krill oil is complex with phosphatidylcholine. It goes directly into the brain. Now, on the Neuro website, the science is there if anyone's interested, is the MFSD2A system, which allows only phospholipid-bound omega-3s to get into brain. Other omega-3s are very difficult to get into the brain. So what a lot of physicians that take care of neurodevelopmental disorders are doing, such as ADHD and autism, epilepsy, etc., is they're using krill oil. Krill oil is naturally bound to phosphatidylcholine. That not only gets the omega-3s into the brain, but it also gets the phosphatidylcholine into the brain, which is also very important in brain health. And that also brings choline, which is part of phosphatidylcholine, into the brain. Choline is part of the major neurotransmitter acetylcholine. So when I designed Omega Needs, I knew I wanted to have a moderate dose of krill oil in there to be able to give the brain the omega-3s that it needed. But for the rest of the body, there's high dose fish oil in there. That's good for cardiac health. It's good for blood pressure, blood sugar. It's also good for cosmetic reasons. A lot of people take that because it helps with skin, hair, and nails. I also realized that phosphatidylserine is another phospholipid that the brain needs. That's found in plants. And so I added phosphatidylserine that was derived from sunflower seed. So Omega Needs is high dose fish oil plus krill oil plus phosphatidylserine that comes from sunflower seed.
So when people or patients come to you, what kind of symptoms would one present that would lead you to prescribe, say, Omega Needs or an omega-3 in general?
Well, first of all, as I said, it's essentially everyone in the world, at least in the industrialized world, should be taking an omega-3 product. So anyone that's interested in brain health should be taking a product that has krill oil as at least part of it, or to take, say, a fish oil and krill oil supplement separately if they wish. That's not only for people that are interested in the neurodevelopmental disorders or the early life issues like epilepsy, autism, ADHD, but that's also people that are interested in brain health on the other side of the age spectrum, people that want to reduce the chance of developing senile dementia like the Alzheimer's type, Parkinson's, and other brain disorders that tend to come up with age. So it also, like I said, it helps with cognition and focus in any person, regardless of whether they have a diagnosis or not, at any age. So really anyone who's interested in brain health should make sure that at least part of their omega-3s are from krill oil.
I want to go back to the one point that you made just to make sure we understand this. So Omega Needs has fish oil, the traditional omegas that you might find in a typical product, but then you added krill oil as well, goes right to the blood-brain barrier, and then you added sunflower seed oil.
Well, the phosphatidylserine that's been derived from sunflower oil, yes.
Now, does that also go directly to the blood-brain barrier?
Yes.
Okay. All right. I just want to make that clear. And then what kind of benefits have you seen in your patients that are taking fish oil products like Omega Needs?
Well, I originally designed it for my own son who had very severe ADHD, and that's actually how I started really doing research in this area. I had him on a fish oil product, and I also had him on a krill oil product. But and that made a difference. But I figured that we could mix them together, and he wouldn't take the two products. Plus, I hadn't put him on the phosphatidylserine. So when I made Omega Needs, I made sure that I had the high dose fish plus the good amount of krill plus the phosphatidylserine. When I put him on that, it changed dramatically. Before that, he was on what a lot of the kids were on. They were on a stimulant, like an amphetamine-like drug. And that had a huge amount of side effects. If he took the drug, he could listen in class, and he did well in school, but he couldn't eat that day. He was nauseated all day long, and it affected his personality. He didn't like the person he was on that. If he didn't take it, he was a really fun child to be around. Everyone liked him. He could eat, but he couldn't concentrate at all in class. He didn't understand anything. So he alternated between taking it one day and not taking it the next day. And that was still affecting that obviously was affecting both his health, his weight, and his ability to his school grades were not doing very well at all. On Omega Needs, he did much better. In fact, he got off of the stimulant completely, and then later got off another psychotropic drug. And on Omega Needs, plus some of the other products that we make, Energy Needs and Q Needs, he's actually in college now getting good grades on no medications at all. We started commercializing Omega Needs, and I've noticed that it's working in a lot of my families, that it's really made a big difference. And in particular, they speak about their focus, their attention being better, whether they're have a desk job, an executive that doesn't have any diagnosis at all, but it's not natural to sit at a desk 10 hours a day and concentrate, or whether they have ADHD or anything else, that they're able to focus much more. I'm also using it in the neurofunctional disorders, patients with chronic pain, such as migraine or fibromyalgia, irritable bowel, chronic fatigue, chronic dizziness, as well as anxiety and depression, and finding out that it's also extremely helpful in that. So omega-3s do so many different things for the brain. They make up a large part of the brain. They're involved in many of the things the brain does, but they're also highly anti-inflammatory. And many of those conditions are at least in part due to inflammation in the brain. There's also astaxanthin in it that naturally comes from the krill oil, which is a great antioxidant that helps with mitochondrial energy metabolism.
All right. Well, and how safe and tolerable is Omega Needs? So you've got a lot going on within the product, but how safe and how tolerable is it?
Well, like all of our products, it's a natural substance, and the natural substance is in foods. And it's expected to be safe, and it is safe. I mean, nobody has ever mentioned that there's significant side effects by taking omega-3s, whether they come from krill or fish or any other organism. In my experience, there hasn't been a single person with a serious or an irreversible side effect. The only two side effects we see are the same ones you can get with pretty much anything. Number one, it can cause nausea. So I always recommend start at a lower dose, one capsule a day, or even less if you want to cut the capsules in a smaller child. Work up to the full dose of one capsule twice a day. And take it with a meal at least at first. That seems to make a big difference with the nausea. The people that have the nausea tend to be taking it with only a snack or without a meal. The other one is that any supplement, again, can make the way that you feel a little bit different. But in Omega Needs, that's really extremely rare. And if you start one a day and you take it with a meal, that hasn't been an issue. So it's very highly tolerated.
And one of the questions people ask quite a bit is how long does it take for me to see some improvement or benefits?
Well, there's a lot of different ingredients in it. I mean, just the fish and the krill have tens of thousands of ingredients, and they work by different mechanisms, so they kick in at different times. Some people can see a difference within days. It's not something you're going to notice within minutes or in hours, like you take ibuprofen or something like that. Other people notice it in weeks, but there's definitely an improvement which goes up to months. So patients that are on it for 3 to 6 months will definitely notice improvements they didn't at 1 month. But I always tell people give it a couple months, 2 to 3 months, because it can take that long. And then if you see benefit at that time, which the vast majority of people do, it will continue to increase.
Okay, well, thank you, Dr. Boles. This was really informative and interesting, and we're going to continue this discussion, and I hope the rest of you out there will join us again for our next podcast. Take care. Bye.
All right, welcome. Bye.
As always, consult your physician before trying any of our products. For more information, visit neuroneeds.com. We would appreciate it if you would like, share, and subscribe. Thanks for being part of our journey.